Hello, everyone. I am honored to address you at the Delaware Health Mother and Infants Consortium's 18th Annual Summit. And I want to thank the members of DHMIC, the advocates, and the honorees for all of your advocacy and hard work in making a difference in the lives of Black women and children. Today marks the last day of Black Maternal Health Week. But we all know it's not the last day of our work to address the inequities in our healthcare system, to deal with the social drivers of health that create the outcomes that we see, and finally, to protect Black mothers and babies. In the United States, one of the richest countries in the world, we are the only developed nation where maternal mortality is on the rise. For Black women, we are 3 times more likely to die from pregnancy-related causes than our white counterparts. But we also know 80% of those deaths are preventable. Here's another sobering reality in America. We have a twin crisis. Black infants are almost 2 times as likely to die before their first birthdays than white infants. Our sisters, friends, and neighbors should be looking forward to bringing their babies home, to first words and first steps. But instead, partners and families are left devastated. The fact of the matter is, we all have our own stories to tell or know someone who has been impacted by the maternal and infant health crises in this country. As a Black woman, a daughter, a sister, a mother, and now a grandmother, I've seen firsthand the difficult healthcare experiences that Black women face when pregnant and the heartbreak of losing a precious new life. And now, representing Delaware in Congress, I have seen how these stories that reverberate in our communities, homes, and hospitals are sometimes merely whispered in the halls of power. In the room where decisions are being made, the policies that determine our lives, bodies, and futures have not always been decided by the people who are impacted the most. But today is a new day. We owe it to our communities to talk about why disparate health outcomes exist, how we can eliminate the gaps in the social drivers of health, how we can feel seen and heard by decision makers, and how we can become the decision makers. That brings me to the important work of DHMIC. Today's theme, Imagine, Impact, Innovate, Driving Equity in Infant and Maternal Health, reflects DHMIC's mission and footprint. We can all imagine a world where all moms and babies are healthy because healthy mothers and children are at the center of a healthy community. The way we get there is to innovate, and that's exactly what DHMIC has done and is doing. You have championed better standards of care for women and children, pushed for more research so our experts are armed with the information they need to address the disparities, and demanded from our hospitals, agencies, and professionals that we focus on this and create policy change that will save lives. As we close out Black Maternal Health Week, I join you all in an urgent call to action to be bold and break down systemic barriers Black women and children face in accessing quality, culturally competent health care. And I will continue to work with all of you to imagine, impact, and innovate for our lives, for our futures, and for our children. Thank you for all of the work that you do.